The Oregon Health Authority hosted a public media briefing today on the current status of COVID-19 as well as the monkeypox virus. Carly Keenan listened in and joins us now with the details. Carly?
Yeah, Lee, we're 2.5 years into the pandemic, and cases here in Oregon are mirroring what the CDC is seeing nationally. But people are still getting sick and ending up in the hospital. The fight against COVID-19 continues as new variants appear and hospitals still struggle with staffing shortages. The Oregon Health Authority says daily cases of COVID-19 across Oregon have leveled from June to July. But hospitalizations have climbed, and the Omicron subvariant BA.5 isn't helping. While people are still ending up in the hospital, there are fewer than during the Delta and Omicron waves. Dean Seidlinger, the OHA's state epidemiologist, says there are still unknowns surrounding BA.5.
We are monitoring the percentage of folks who are in the hospital with COVID-19 who wind up in the ICU, and that percentage seems to be trending up a little bit, indicating that there may be an increased severity with BA.5.
As of Wednesday, Deschutes County has 84 new COVID-19 cases and 2 new deaths. Seidlinger highlighted the struggles hospitals across the state are facing, focusing on St. Charles.
In Central Oregon, I think a hospital system is even more stressed than they are in the rest of the state. The St. Charles Health System in Bend has, definitely been working through many staffing challenges and strains on their system, and OHA continues to have conversations with them about things that we can do together that they can do on their own to help with those strains.
Adding the capacity for hospital beds exist, it's the staff that doesn't. Through the state's pandemic response, the OHA wants to highlight the burnout healthcare workers continue to experience.
The skilled staff, nurses, physicians, respiratory therapists, and all the others who need to care for those patients who are in limited supply because of direct impacts from COVID-19 right now, as well as burnout and exhaustion from these past 2.5 years.
The OHA also highlighted the importance of getting vaccinated against COVID-19 to prevent the spread. Lee?